Hello, everyone, and welcome back. If you're a parent, you've probably experienced that moment when your child wakes up crying in the middle of the night, pulls at their ear, or suddenly becomes fussy after having a cold. Ear infections are one of the most common reasons children visit a healthcare provider, and they can be stressful for the whole family. Seeing your child in pain naturally makes you want to help as quickly as possible. The good news is that many ear infections improve with time and supportive care. And understanding what is happening inside your child's ear can help you make informed decisions without unnecessary panic. Today, we're going to explore what ear infections are, why they happen, the symptoms to watch for, and how parents can safely care for their child while knowing when professional medical treatment is needed. First, it's important to understand that not every earache is caused by an infection. Children may complain of ear pain for many different reasons. Sometimes the discomfort comes from pressure changes during a flight, water trapped in the ear after swimming, teething in younger children, allergies, or even pain that spreads from the throat or jaw. However, one of the most common causes is an infection of the middle ear, which is the small air-filled space located behind the eardrum. This area normally stays dry and contains tiny bones that help transmit sound. When it becomes filled with fluid and inflamed, it can become painful and affect hearing for a short period. To understand why ear infections are so common in children, it helps to know a little about ear anatomy. The middle ear is connected to the back of the nose by a narrow tube called the eustachian tube. This tube has an important job. It helps equalize pressure inside the ear and allows fluid to drain away naturally. In young children, this tube is shorter, narrower, and more horizontal than it is in adults. Because of this, it becomes blocked more easily, especially during colds or allergies. When the tube is blocked, fluid can build up behind the eardrum. That trapped fluid creates the perfect environment for viruses or bacteria to grow, leading to inflammation and sometimes an ear infection. Most ear infections actually begin with something completely different, a common cold. Your child may have a runny nose, cough, sore throat, or mild fever for several days. As the cold causes swelling inside the nose and throat, the eustachian tube may become blocked. Fluid that normally drains from the middle ear becomes trapped. In some children, that fluid stays sterile and gradually disappears as the cold improves. In others, viruses or bacteria multiply in the trapped fluid, causing pain, pressure, fever, and inflammation. One question many parents ask is whether every ear infection requires antibiotics. The answer is no. Medical research has shown that many ear infections, especially those caused by viruses, improve on their own as the child's immune system clears the infection. Even some mild bacterial infections resolve without antibiotics. This is why healthcare providers sometimes recommend a period of careful observation, particularly for older children who have mild symptoms. However, every child is different, and treatment decisions should always be based on the child's age, symptoms, overall health, and the advice of a qualified healthcare professional. Knowing the symptoms of an ear infection can help parents recognize when something may be wrong. Babies who cannot yet speak often communicate pain through their behavior. They may cry more than usual, have difficulty sleeping, refuse to feed, or become unusually irritable. Some babies repeatedly pull or rub one ear, although ear pulling alone does not always mean there is an infection. Older children can usually tell you that their ear hurts or feels full. They may describe pressure, muffled hearing, popping sensations, or discomfort that becomes worse when lying down. Some children develop a fever, while others do not. Temporary hearing changes are also common because fluid behind the eardrum interferes with the normal movement of sound. As parents, it's understandable to feel worried when your child develops a fever along with ear pain. Fortunately, fever is simply one sign that the immune system is responding to an illness. A mild or moderate fever does not automatically mean the infection is severe. Instead of focusing only on the number on the thermometer, it is also important to pay attention to how your child is behaving. Are they drinking fluids? Are they awake and interacting when their fever comes down? Are they breathing comfortably? These clues often provide a better picture of how sick your child is than the temperature alone. Another symptom that sometimes surprises parents is fluid draining from the ear. This can happen if pressure builds behind the eardrum and causes a small tear. Although seeing drainage can be alarming, the hole often heals on its own with appropriate medical care. However, drainage from the ear should always be evaluated by a healthcare provider because it may change the treatment plan. Many parents wonder why some children seem to get repeated ear infections while others rarely experience them. Several factors increase the risk. Children under 5 years old are more susceptible because their immune systems are still developing and their eustachian tubes are smaller. Attending daycare increases exposure to viruses from other children. Exposure to cigarette smoke can irritate the airways and increase inflammation, making infections more likely. Seasonal allergies may also contribute by causing swelling in the nose and eustachian tubes. Family history plays a role as well, meaning some children are simply more prone to developing ear infections than others. During the colder months of the year, ear infections tend to become more common because respiratory viruses spread more easily. A child may catch several colds throughout the season, and each cold creates another opportunity for the middle ear to become inflamed. This is one reason why good hand hygiene, covering coughs, and keeping sick children home when possible can help reduce the spread of infections. Another common concern among parents is whether swimming causes ear infections. The answer depends on the type of infection. A middle ear infection, which occurs behind the eardrum, is usually related to viruses or bacteria following a cold rather than water entering the ear. However, swimming can sometimes contribute to an outer ear infection, commonly known as swimmer's ear, which affects the ear canal instead of the middle ear. These are different conditions with different treatments, so it's important not to confuse them. Let's also talk about pain, because pain is usually what worries parents the most. Ear pain can range from mild discomfort to intense throbbing that makes it difficult for a child to sleep. The pressure created by trapped fluid pushes against the sensitive eardrum, which is why children often become more uncomfortable when lying flat. Keeping the head slightly elevated for older children may sometimes provide temporary relief, but parents should always follow safe sleep recommendations for infants. One of the biggest myths surrounding ear infections is that they always require immediate antibiotics. Years ago, antibiotics were prescribed much more frequently. Today, healthcare providers understand that unnecessary antibiotic use can contribute to antibiotic resistance, making future bacterial infections harder to treat. Antibiotics can also cause side effects such as diarrhea, stomach upset, and allergic reactions. This doesn't mean antibiotics are bad. They can be life-saving when truly needed, but using them only when appropriate helps protect both the individual child and the community. At the same time, it's equally important not to ignore a child who appears seriously ill. Severe ear pain, high fever, swelling behind the ear, redness spreading around the ear, persistent vomiting, extreme sleepiness, or symptoms lasting longer than expected deserve prompt medical evaluation. Trust your instincts as a parent. If something doesn't seem right, or your child's condition is getting worse instead of better, don't hesitate to contact your healthcare provider. As we continue through this guide, remember that the goal isn't simply to stop ear pain as quickly as possible. The goal is to understand why the infection developed, support your child's recovery safely, recognize situations where medical treatment is necessary, and help reduce the chances of future infections. Knowledge gives parents confidence, and confidence makes it easier to care for a sick child during those stressful nights. In the next part of this guide, we'll discuss practical home care strategies that can help keep your child comfortable while they recover. We'll cover hydration, rest, safe pain relief, warm compresses, what the evidence says about natural remedies, how to help children feel better during recovery, and simple lifestyle habits that may lower the risk of future ear infections. By combining supportive care with good medical judgment, Parents can make informed decisions while giving their child the best possible chance for a smooth recovery. We talked about what ear infections are, why they happen, and how to recognize the most common symptoms. Now let's focus on something every parent wants to know. What can you safely do at home to help your child feel more comfortable while their body recovers? Although there is no instant cure for an ear infection, there are many supportive steps that can reduce discomfort, encourage healing, and help your child rest. The key is understanding that your goal isn't just to make the pain disappear for a few hours, but to support your child's immune system while carefully watching for signs that medical treatment may be needed. One of the most important things you can do is simply help your child rest. When children are sick, their bodies use a tremendous amount of energy to fight infection. Sleep allows the immune system to function at its best, helping the body produce the cells and proteins needed to recover. Some children become extra sleepy during an illness, while others have trouble sleeping because of ear pain. If your child is restless at night, don't worry if they sleep more during the day. Their body is telling them what it needs. Try to create a calm, quiet environment with dim lighting, minimal noise, and plenty of opportunities to rest without pressure to play or be active. Hydration is another simple but powerful part of recovery. Fever, reduced appetite, and mouth breathing caused by nasal congestion can all increase the risk of dehydration. Encourage your child to drink small amounts of fluid throughout the day rather than expecting them to finish a full glass at once. Water is an excellent choice for older children, while infants should continue breastfeeding or formula feeding unless your healthcare provider recommends otherwise. Warm soups and broths can also be comforting for older children because the warmth may soothe the throat and encourage fluid intake. Staying hydrated helps keep mucus thinner, supports normal body functions, and makes recovery easier. If your child has a stuffy nose along with an ear infection, relieving nasal congestion may also help them feel more comfortable. The eustachian tube connects the middle ear to the back of the nose, so swelling in the nasal passages can contribute to pressure inside the ear. Using saline nasal drops or a saline spray can help loosen mucus without medication. For babies, a gentle bulb syringe or nasal aspirator may help remove mucus before feeding or sleeping. These methods won't cure the ear infection itself, but they may improve comfort by helping the nose stay clearer. Pain relief is one of the biggest concerns for parents because ear infections can be extremely uncomfortable. Children often cry more at night because lying down changes the pressure inside the ear. If your child is in significant pain, healthcare providers commonly recommend age-appropriate pain relievers such as acetaminophen or ibuprofen, depending on your child's age and medical history. These medicines don't treat the infection itself, but they can reduce pain and fever, making it easier for your child to rest, drink fluids, and recover. Always follow the dosing instructions provided by your healthcare provider or the medication label, and never give aspirin to children because of the risk of a rare but serious condition called Rey syndrome. Another comforting option is applying a warm compress to the outside of the affected ear. A clean washcloth soaked in warm, not hot, water and gently wrung out can be placed over the ear for several minutes. The warmth may help relax nearby muscles and temporarily ease discomfort. Be careful to test the temperature on your own skin first to avoid burns, especially because children's skin is much more sensitive than an adult's. While a warm compress won't eliminate the infection, many parents find that it provides short-term comfort during painful episodes. Parents often ask about natural remedies, and this is an area where it's important to separate traditional practices from scientific evidence. You may hear recommendations for garlic oil, herbal ear drops, essential oils, or other home remedies. Some people report that these approaches help them feel better, and certain herbal products have been studied on a limited basis. However, the scientific evidence supporting these treatments remains limited, and they should not replace appropriate medical care. Most importantly, Never place oils, herbs, or homemade liquids into your child's ear if there is drainage, a suspected ruptured eardrum, ear tubes, or if a healthcare professional has advised against it. Doing so could potentially cause irritation or complications. When in doubt, speak with your child's healthcare provider before using any product inside the ear. Essential oils are another topic that often comes up on social media. While some parents enjoy using diluted essential oils for relaxation or massage, they should never be placed inside the ear canal. Children's skin is delicate, and essential oils can sometimes cause irritation or allergic reactions if used improperly. If you choose to use any complementary therapy, remember that natural does not automatically mean safe. Always use products according to their instructions, keep them out of children's reach, and discuss them with your healthcare provider if you have questions. Nutrition also plays a valuable role in supporting your child's recovery. During illness, many children lose their appetite, and that's usually normal. Instead of worrying about getting them to eat large meals, focus on offering small portions of nourishing foods whenever they show interest. Fresh fruits, vegetables, whole grains, lean proteins, yogurt if tolerated, and homemade soups provide vitamins, minerals, and protein that support normal immune function. Vitamin C, zinc, and other nutrients are important for overall health, but most children can get what they need through a balanced diet rather than high-dose supplements, unless a healthcare provider recommends otherwise. Parents sometimes wonder whether dairy products should be avoided during an ear infection. The evidence on this topic is mixed. For most children, dairy does not cause ear infections or significantly increase mucus production. However, if a child has a diagnosed cow's milk allergy or another medically confirmed food allergy, avoiding the trigger food is important for their overall health. If you suspect your child may have a food allergy or intolerance because of ongoing digestive symptoms, eczema, poor growth, or repeated reactions after eating certain foods, discuss those concerns with your healthcare provider instead of removing major food groups on your own. Keeping your child comfortable also means helping them manage everyday activities. If they don't feel like running around, that's perfectly okay. Quiet activities such as reading books together, coloring, building puzzles, or watching a favorite movie can help pass the time while they recover. Gentle cuddles, reassurance, and simply being present often provide as much comfort as any medicine. Illness can be scary for children, especially younger ones who don't understand why they feel different. Your calm presence helps them feel safe. Preventing future ear infections is something many parents are interested in, especially if their child has experienced several episodes. While it's impossible to prevent every infection, there are healthy habits that may lower the risk. Good hand washing is one of the simplest and most effective ways to reduce the spread of viruses that often lead to ear infections. Teaching children to wash their hands before eating, after using the bathroom, and after coughing or sneezing can make a meaningful difference over time. Keeping children away from cigarette smoke is another important preventive step. Secondhand smoke irritates the lining of the nose, throat, and airways, increasing inflammation and making it harder for the eustachian tube to function normally. Even smoke that lingers on clothing or furniture can expose young children to harmful chemicals. A smoke-free home and car create a healthier environment for children's ears and lungs. For infants, breastfeeding has been associated with a lower risk of ear infections during the first months of life. Breast milk contains antibodies and other immune-supporting components that help protect against many common infections. Every family's feeding journey is different, and parents should choose the feeding method that works best for them with guidance from their healthcare provider. If breastfeeding isn't possible, remember that many children who are formula-fed also grow up healthy and do very well. Vaccinations are another important way to reduce the risk of certain infections that can contribute to ear infections. Staying up to date with recommended childhood vaccines, including the pneumococcal and annual influenza vaccines when appropriate, may lower the chance of illnesses that sometimes lead to middle ear infections. Vaccines cannot prevent every ear infection, but they can reduce the risk of several serious infections that affect children. As your child begins to recover, you may notice that their hearing seems slightly muffled for a short time. This can happen because fluid remains behind the eardrum even after the infection improves. In many cases, that fluid gradually clears over several weeks without additional treatment. However, if hearing problems continue for an extended period or begin affecting your child's speech or learning, it's important to arrange a follow-up evaluation with their healthcare provider. Remember that every child is different. Some recover within a few days, while others need a little longer before they return to their usual energy level. Be patient with the healing process, continue offering comfort and fluids, and follow any treatment plan recommended by your healthcare provider. Most children recover completely and go back to their normal activities without any long-term problems. In the final part of this guide, we'll discuss when antibiotics are truly necessary, the warning signs that mean your child should be seen by a healthcare professional immediately, common myths about ear infections, answers to frequently asked questions, and practical tips for reducing the chances of recurring infections in the future. The more you understand about ear infections, the more confident you'll feel when caring for your child during those stressful moments.